Hi Gary, how are you?
Hey Jack, good to be back here actually chatting with you. Yeah, as I was telling you a bit ago, I'm doing quite well actually. I had quite a bit of a break after the end of my residency, so now I'm back and ready to work and speak. So
Awesome. Would you be able to tell the audience a bit about, for people that don't know you, about your background in clinical psychology, and then also maybe what you've been doing recently and how it's developing for you?
sure, yeah. I just completed my PhD in clinical psychology, and I am a clinical psychologist in supervised practice, which basically means that after the completion of your degree, which usually takes 5, 6 years, you have to do some more work for about a year before you get licensed. So I'm in the early career stages of my life as a psychologist. And yeah, I should also say that I would characterize myself as an existentially and psychoanalytically oriented psychologist. What that basically means is when people come to me with certain presenting concerns, symptoms of sorts, let's say, a bad mood like depression or a lot of anxiousness, uh, however debilitating it may or may not be, what I try to do is not just see the task of treatment as the reduction of those symptoms, but the task is sort of to understand what those symptoms are doing for the person. A way of thinking about this is that whatever your anxiety is or whatever your depression is, it's not just a problem, it's a form of problem solving that's sort of gone wrong in some sense. It's no longer working in the service of you and your projects and your health and well being, but against you. So I'm a depth oriented psychologist. I like to go under the level of
Mm,
symptoms and into the level of dynamics and what's actually going on and how much of this is something you want to continue letting happen and even participate in because that's always an option, and how much of it is something that you might want to do make a different choice about. So that's sort of the heart of my work, not to alleviate people's suffering per se, but to get them to a point where they're conscious of what's relevant in what's going on so that they could choose on their own how to orient themselves toward their own being.
interesting. So they can do a kind of meta sort of analysis on themselves, and would you say that that kind of equips them like later on to like say they occur and they have recurring issues later on? Do you think that they would then like have? Would you like ultimately like to have the aim of they would then be able to better sort out issues later on themselves and be equipped with the skills to do that rather than like say having to come back to psychotherapy?
I would say that that's one of the main aims, but it's not the ultimate aim per se, because I think it's sort of a cultural myth or zeitgeist that we've sort of inherited at this point that uh, we ought to deal with our own issues as individuals, independently of others and independent of supports. So I I don't see the like if we go back to the saying, if you give someone a fish, you fed him for a day, but if you teach him how to fish, then you fed him for a lifetime. Um, I I don't think the point of psychotherapy is to get them to learn how to fish so that they fish on their own for the rest of their life, but so that they also have that option in addition to fishing with others when need be, and to have a kind of flexibility in their field of possibilities that permits them to, navigate life and its complexities in a way that's effective for their own self and for their world, so to speak.
And as you say that, it makes me think that then perhaps another aim is trying a almost cultivation of like relationships and life structures and like say goals or like career directions and things, so that they have like affordances in their environment that like help them even if they were to like undergo issues again. So it's not just they need to deal with it by themselves, but they would. they would have fostered, say, family relationships that are stronger, and as again, so it doesn't have to be, individual. So you know, I really love this thinking about your approach. But one cool place to start would be, I'm wondering, when first someone enters the clinic room, what are the range of things that they come to you for, or just one for generally, and like where does one begin?
Excellent question. And in some ways, it's also an intimidating question because there's something about the nature or the structure of psychological suffering that's kind of intractable, and that it has so many different masks, so many different faces, and it's hard to classify all these different things as one thing. So maybe I could broach the question from that particular angle, that it's not so much the particulars themselves as how one is oriented toward them in the context of their own living. That's the uh, area of concern for me as the clinician. So whether it's something like I'm feeling anxious and very demotivated to work, I don't have much of a social life. In fact, I avoid people quite actively in my life, or I drink a little more than I should, or I play way too many video games way too much of the time. Whatever it might be, my first response is, can you tell me some more about what's going on? Like, how are you seeing it? And there's actually a methodological reason for why that's sort of the primary question that comes out of my mouth. The methodological reason is that as much as theory and the scientific body of literature that supports and provides evidence for the treatments that psychologists ought to be implementing in their work, what we have to do is stay with the experience of the person first. So I have to bracket all of my assumptions as best as I can and just sort of like pretend in some sense that I'm starting completely in the dark with nothing to go on. And so I ask the person, what is it that you're seeing from where you're standing about what's going on? And what that does is it places me from within uh, their sort of personal perspective. And then we start, rather than speaking to them or at them from the outside in, I come in and we start articulating things from the inside out. And there's a different sense that comes with that, a different feeling, and it helps to cultivate a deeper alliance. I think this is part of the essence of clinical empathy, actually. Um, it also harkens back to one of the main values that psychologists are supposed to go by, which is not to provide their own opinion per se, not to offer advice or direction or anything like that. Um, Precisely because it's there's this assumption that essentially pretty much comes from the humanistic traditions, that whatever you need in order to move forward rather than regress backward, it's already within you. It just needs to be tapped into, and it's through this process of placing myself right next to you and looking at things as you're looking at them, so that I could see how you're seeing your horizon and how you're relating to it, that I could then keep track of things as you're keeping track of. And that's when you know that I'm there with you. I'm not just an outsider who's telling you things. I'm living what you're living by proxy. And that's where, uh, that's one of the places I feel that therapeutic change and growth begins to happen. So that was, sorry for reframing or reformulating the question itself, but methodologically, this is sort of how I approach whatever it is that anybody brings to me in the clinic room, um, which helps to begin unpacking things, whether they have to do with depression or anxiety or substance use or anger or interpersonal problems or anything really.
Thank you. I think that I kind of want to pick up on there is that you say, someone might come to you kind of appreciating the problem they have. They might know that, oh, I don't have motivation in my job, or I appreciate that I drink too much, and yet they also themselves don't quite know, even though they know in one sense, they also like actually don't know, and they themselves need to see their own issues from a different perspective, right? So as you kind of discover their issues, they're also having to sort of like discover those issues for themselves. So it's kind of like it seems to me like an unraveling of like the issue, and so interesting.
Very well
First,
said. And let me add this bit too, actually, because uh, a very common experience amongst any psychotherapy patient is the feeling that uh, there's something wrong with me for having this experience. This is very unique to me. I'm doing something wrong, and it's sort of my fault if we boil it down to the bare basics of like what's going on. And like I oftentimes find myself from listening to my patients about their stories of the kinds of issues they're dealing with and like what they're confronted with. I find myself feeling feelings of helplessness and hopelessness and like a deep weight and burden as well. And there's a feeling of defeat that also comes with some of these experiences as well. And so um, when they see me experiencing this and voicing it to them, uh, there seems to be the possibility of a certain kind of validation in those moments, because it's like, wait, so it's normal to feel the way that I'm feeling in response to the situations that I'm faced with. So depression would be the normal response if somebody has lost their job, lost their relationship, had someone in their family diagnosed with a terminal illness all at once. Gosh, so it is hard after all. And the message here is that we're not here first and foremost trying to solve your problems. We're trying to formulate the problem in its entire depth as best as we can to begin with, to see how bad it really is. Because if it's bad, we need to know how bad it is. And we need to like sort of take it in slowly and in a paced manner, so that it's true and honest to the experience, but in a way that's by being paced, it's contained so that it's not entirely overwhelming like a flood, for example, that wipes everything out.
it's there's a couple of things I want to pick up on there, but one is that almost in a way personally kind of embodying the emotions. You're not that like detached necessarily. Like it's not necessarily a good thing, because you need that kind of empathy. So I mean, I wonder if you could touch a bit more on that. Like, I know there's a concept in psychology called sort of transference. I don't know if this might be the wrong use of the word, but like where there is a necessary distance, right? The closeness, but they can't be too close. And so I'm wondering, like, then the next stage, like how given that like it's not necessarily just psychological issues, you say like there's real problems that they come in with you, and that doesn't mean that you can't come in with those, because they intermix with the psychological and personality and everything. So from there, how, say for example, how might you build a relationship with them? How do you get like a right level of closeness such that
Hmm.
they don't feel like distance from you, but you can also like get new perspectives to help solve their issues?
Excellent. Yeah. So let me let me tell you a little bit about a certain technique that I would say characterizes the existential approach specifically, but like any good psychology more generally. Um, so let's go back to the moment where you hear your therapist say something like, "Wow, that is hard." Like where you're at is a dark place. It is a scary place, and it's a debilitating place in some sense. At that moment, the part of the therapist's task, as I see it, is to try to facilitate a certain kind of reflexivity So I'll give you an example first, and then like unpack the sort of theoretical principles underneath it. You get to that point, and the patient says something like, like how am I gonna like go up there and say what I have to say, uh, imagining a scenario where they have to let's say have a certain kind of confrontation with a family member or a friend or whatever. It's like, how am I going to go up there in front of that person and actually say what I have to say? And that's a rhetorical question, the way it's being expressed. It's more like, I'm scared of moving into it and I'm not going to do it. I don't want to do it. But it's phrased as a question, right? So part of what I actually like to play around with when possible is when I hear those kinds of rhetorical statements or questions, I reflect on that, put it into words, and say to them, you phrased it as a question, but the sentiment behind it is that I'm kind of scared of like moving into this and doing it, and I'm actually not going to do so. But how about we try to ask it as an actual genuine question? How am I going to move into this? And how am I going to speak? How am I going to convey what's important to me in the moment? And so what you see is a certain kind of attitudinal shift, a kind of reframing of the anxiety of moving into a scary, sort of dark, unknown experience, into a kind of curiosity as to what might make that sort of movement possible. And I think that speaks to the function of like genuine questions, real questions, wonderful questions in the context of therapeutic change, and wonderful in the sense of full of wonder. Let's wonder about this together. Let's be curious. So
Interesting. Um, uh, kind of again, like as we touched on earlier, a kind of I'm interested in how much the client sort of then kind of has to do things on their own, but then how it's almost like, I don't know, I don't want to trivialize it, but in some ways the psychotherapist is giving them the confidence or like the sort of foundation to be able to grapple with a problem that, like, in a way they might already be equipped to handle, but it's like how do you approach it, and like you kind of iteratively have to like almost gain the skills and gain the confidence to go into it. Well, if you have anything to say, then please jump in. But I kind of wanted to ask, what attitude, what skills like does someone bring as a client as that they go into psychotherapy, which makes them most successful in solving the problems that they do? Are there things that you can pick up on at the start and go, oh, actually, this person is probably going to be successful in doing that? If this is the right, way to formulate, because maybe success is not a good word. I don't know, but yeah, yeah.
yeah, so a couple of things. So first thing, actually, that just taking a step back to the previous topic of that moment where that reframing
Mm.
takes place from right, transforming an anxiety into a question. The sort of meta point there is that it's during these moments that the patient is surprised at what's happening with their relationship with anxiety. So their relationship is slowly shifting from one of avoidance to one of approach. And the basic idea across all the schools of therapy is that pretty much most severe forms of psychopathology are in one way or another organized around avoidance. And so you're slowly, through this kind of disciplined curiosity, you're facilitating the kind of change that helps dismantle that relationship of avoidance. And so that the person is, by being surprised at their own capacity to approach, they're encouraged and reinforced to do so more in the future. And so it's through a certain kind of co-participation of patient and therapist in patient struggles that the patient acquires the relevant skills to reenact those manners of participation in the context of their internal life, allowing for other forms of relationship with respect to their suffering to unfold than just those organized around avoidance. And that's sort of the spiritual change or transformation that happens. Now, bringing this back to the question you just asked, there are different kinds of markers for what makes for good therapy, both on the client's side and the therapist's side. Before I speak to any of those, I'm wondering if you would like to jump in, or if you have reactions to anything I just shared.
I don't. I think that's no. I do in the sense that I've been looking a bit about at avoidance and attachment theory and attachment, and the interesting thing that it starts so young in our life, right? And that you say it's actually this perennial problem that characterizes many instances of psychotherapy. So I kind of just wanted to ask if we could like delve into exactly what that is, but you might have sort of
Sure.
caught another path to take. But I think if you because you lay out how that's very important, and the reciprocal relationship between oneself and the psychotherapist helps untangle that, and helps sort of get oneself into like a new kind of cycle and sort of dynamical system, in the sense to, you know, in a new equilibrium to like help. So yeah, like maybe we could touch on that and what is avoidance and attachment theory.
Sure. Okay. So, very quickly, and all these questions, because of how they're so interestingly like interrelated, they all touch on different aspects of the same thing. So I'm starting to find that any answer to any of these questions is somehow going to lead to the other questions too. So
Uh,
that's a cool kind of flow to notice. Um, from the from the so starting from the markers of like what makes for good therapy, um, on part of the patient, an emotional kind of openness and willingness to move in and explore. And there are personality differences in these sorts of markers. Like some people who are particularly high on trait openness, um, part of what comes along with that is a sort of aesthetic sensibility and kind of contact with their emotional life. Um, and people who are already quite actively engaged with their thoughts, with their experiences, they tend to be more well suited for therapeutic change. But I think the real kicker is that it's not sort of the individual markers themselves that are so important as the therapeutic relationship. There's a body of literature on the common factors of change in therapy, uh, which essentially is, so the history behind this is very interesting. As we know, the field of psychology as a whole is quite fragmented, especially so in the context of therapy and treatment. There are different approaches to psychotherapy that have sort of been at each other's throats at different points in time. First, we had the psychoanalytic tradition, then the sort of behavioristic tradition, then the humanistic tradition, and the existentialists came around, and et cetera, et cetera. And then each of these was like, this is what therapy is about, this is what the therapist's job is, and this is what therapeutic change looks like. Not the way you're saying it, pointing to the other schools. And that was the case with all of them. Now, what they found um, was that, and this is why the body of literature is called the common factors or non-specific factors approach, that it's not what each of the schools says that's right or wrong that matters, but there's something common to all of them that makes them all more or less equally valid and effective for therapeutic change. So when you assess therapeutic recovery and things like that in patients who were treated by an existential psychologist versus a cognitive behavioral therapist versus a psychoanalyst, for the most part, there's no differences between any of the groups. And this is called the dodo bird effect. It comes from Alice in Wonderland, right? You all get trophies, you're all winners, right? Nobody lost. That's why it's the dodo bird effect. And that made them change emphasis from what each of the schools was saying in particular to what all the schools, regardless of what they're saying that's unique, actually have in common. And the common factors, I'll list some of them because I don't remember all of them off the top of my head. One of them is trust. If the patient trusts their therapist, that's a big deal. That's predictive of recovery. Therapeutic alliance, that's a part of trust. I don't remember the role of insight per se, but I think that plays some role in this. Frame is another important one, which has to do with consistency and frequency of sessions, broadly speaking. So there's this whole set of common factors that if any type of therapist of any orientation really incorporates in their work, that's going to be predictive of positive change, whatever that really means in therapy. And there are different criteria for that based on the school, and I've been only sharing my criteria that are based in some of the schools, not all of them. So even though they're not necessarily contradictory or at odds with what some of the other schools might say, like exposure-based therapies are also predicated on the same principle that gradual exposure to things that are being avoided is what leads to recovery, for example. Mm-hmm.
It's great because I kind of asked what skills and what attitudes should someone bring to therapy that would make them most successful, and I think you've then kind of touched on if we want to think about how successful people are going to be, it's about the relationship between them. So things like trust and insight. It's how it's the fit between the psychotherapist and the person coming in. That's gonna be really important. And you talk. It's very fascinating too. I talked to, for example, you a bit, but as well, but also Greg Enriquez as well before about the different schools of psychotherapy and how there won't be a competition between them, and I'm better than you, but then we're realizing the commonalities between them, and it's fascinating. I mean, I don't want to stray too far off because we might be going down a cool route here, but I'm like wondering how psychotherapy has changed like in the last like decades, or even like going in, like as we like progress into the future now. Like, are there becoming more defined ways in which people approach psychotherapy, given that there's kind of been a bit of a synthesis of different fields, and like is it becoming clearer the things that help people be successful, or is it still, still, do you know what I mean? Like, I mean, obviously it's going to be individual between a specific person. But I'm wondering, like, the field as a whole, like, how can we judge success, and how can we and how does it think about how is it in general approaching these sorts of issues, given that we have a better understanding now of what makes people successful.
Yeah. So here's a sort of sleight of hand that was made during the emergence of the common factors literature. The people who were sort of spearheading that literature, that kind of research, they sort of used it as a way of then essentially at the time it was a psychodynamic and analytic approaches that had a predominant hold over the discipline as a whole. The people who pushed forward the common factors stuff essentially made the argument that, well, because all these approaches are no better than any of the others, if you look at the data, let's say, um, then uh, the psychodynamic approach shouldn't be at the very top, having this hold over things. And I'm not exactly sure what happened, but there was a sort of historical moment, a shift, where that's when the cognitive behavioral therapies started to become more and more dominant. And now most schools in clinical psychology, most APA, American Psychological Association, or CPA, Canadian Psychological Association programs, they essentially train people in strictly the cognitive behavioral approaches. And so there's a sort of tyranny of this one type of approach that's happening. Um, I I can't speak very much to the current situation. Like I just don't know enough about this stuff. But my sense is that when people think therapy, they think like the first thing that comes up for them in their mind is CBT, cognitive behavioral therapy. or exposure therapy. And then there's like some variations of that, like mindfulness-based cognitive therapy or ACT, acceptance and commitment therapy. And these start to like blend a little bit with the humanistic approaches and like Buddhist approaches. Um, but they're all variations of the cognitive behavioral schools, which essentially say that psychological problems find their origin in dysfunctional thought patterns and behavior patterns. Therefore, the proper level of intervention is also going to be either the thought level or the behavior level. Um, and there's been a response to that idea by some by a more recent humanistic approach. That's also in some ways a variation of the cognitive behavioral approaches. It's called emotion focused therapy, and it's distinct and different from, but there's some overlap. But essentially, it adds a third layer, the emotional level, and it tries to assert the primacy of the emotional level. And there are similarities between this sort of approach and some psychodynamic and humanistic approaches, because what it's essentially saying is that uh, it's not just thoughts and behaviors that matter, but how people feel about things. And lo and behold, people don't know how they feel about things most of the time when they're experiencing problems because they're confused. And that confusion about how they feel about things is sort of what the problem is. So if you help them to clarify how they feel about the things they're faced with, they'll at least know like how to approach their problems, how to feel about themselves in amidst their problems, etc., etc. So I don't know where the field is heading right now, but there's this undercurrent, this kind of struggle between the uh, sort of hegemony of the CBT school uh, over the entire field and the more niche, um, like humanistic and psychodynamic approaches. And like the most marginalized approach of all of them is probably the one that I practice, which is deeply grounded in the phenomenological school, um, the phenomenological tradition. And both the humanistic and existential approaches are sort of, as I see it, they're derivatives of the phenomenological school, which is deeply consonant with the enactive approach to cognitive science, which takes us out of the discipline of psychology and psychotherapy and into another field as well, which is why not a lot of, let's say, progress or advancement is happening from the corner that I'm working in, because it's so interdisciplinary and it's hard to dialogue clearly and effectively with any one discipline. But okay, that was a lot. So let me pause and see how you feel about that.
I really appreciate that sort of contextualization of different schools. I would love to probe into like different ones, understand them more. But maybe I guess what I'm most interested in is just maybe hearing a bit more about your specific school and how your approach, and like how you would characterize it, and yeah, like its links to like embodied and activist cognitive science, and your sort of philosophy on how the meta approach of you thinking about your clients.
Sure. Yep. Yeah, it's been, I mean, it's been quite a journey for me. Not only in terms of like acquiring and developing the skills for carrying out psychotherapeutic treatment, but also the language for putting into words what it is that I'm even up to when I'm carrying out treatment. Um, and I would say that there's a few core ideas that are sort of at the, so we've already covered the methodological sort of um, commitments that I bring into the clinic room with, which are, bracket my presuppositions or assumptions about what's going on and just get my hands dirty by engaging and making contact with what's there for the person in front of me. Um, so that's sort of the phenomenological edge of what I do. And for those listeners who don't know what phenomenology is, I should have mentioned this a little earlier. Sorry for letting that slip. But phenomenology is essentially, um, it's a first person in some sense study of how people experience things, and the idea here is that as a method, phenomenology allows you to tap into certain meanings that wouldn't be accessible otherwise in everyday language. Like, for example, if somebody comes to me telling me that they saw a ghost and they look terrified and uh, kind of confused and shocked, and I happen to not believe in the existence of ghosts, if I respond to them as I normally would, I would say, "Oh, what are you talking about? Like, you're afraid for no reason. There aren't any ghosts after all." Uh, the phenomenological response is a little different. Rather than looking at what they're saying, you bracket the content, put it aside, and you look at the how of how they're saying it. And if I do that, I immediately recognize and can verbally acknowledge that they had the type of experience that's left them confused, shocked, and terrified. So there are all sorts of needs at play there that would be completely neglected and missed if I had stayed in the initial attitude, which the phenomenologists call the natural attitude. It's the everyday attitude. The phenomenological attitude, it um, um, uh, tells us, it instructs us to bracket those assumptions, those everyday assumptions, and to engage with the person at the level of how they're processing the world, how they're in process in the world, to look at their dynamics and which of those dynamics are thematic of who they are across situations.
Can that be you talk about really appreciating their own, the phenomenology, their own experience of things. Can that be what can be problems there? Is that daunting? For example, um, what if it's strange because you might have to also put on like a kind of a normative judgment of like, what how should you get about, how should you see the world, and so like to what degree can you be kind of feeding, I don't know, not delusions maybe, but like, like you also want to get in there, as we've been talking about, and change their frame. So to what level of acceptance should we have of, someone's experience, and also like relatedly is also like, is it, even if someone tells you about their own experience, I mean, if you've never had that experience before, can it be kind of like, oh, that's how am I supposed to respond to that? You're you in your life, and you're telling me about your experience, and like, do you ever have the experience? I don't know how I could relate to that.
Yeah, great questions, Jack. And I'll say that part of what helps to not like get sort of sucked into like an intractable kind of relativism in these contexts is the the theoretical background and familiarity that I have with the existing body of literature that does tell us important things about how people tend to be, what they value psychologically, and what they need. And this is where attachment theory comes in, actually, as one of the pillars that helps me to uh, tether myself to something more solid, keeping me and protecting me from the risk of right relativism, and also personality theory, trait theory, the Big Five theory that we've talked about in our previous conversation, and I would say those are the main theoretical sort of pillars, actually. And the reason why they act as pillars is because um, so let's start with attachment theory, actually, and very briefly, because I don't think it's that necessary to go way too deep into it. But um, the the underlying rationale for attachment theory, as it was proposed by John Bowlby in the 1940s or 50s, I can't recall. The underlying rationale is evolutionary. The basic claim, the basic premise of attachment theory is that because human infants have the longest maturational period and therefore dependency period of all and any infants in the entire animal kingdom, we're the most vulnerable for the longest period of time during growth, during development. And so attachment and attachment behaviors evolved as a way of ensuring safety by promoting proximity between offspring, neonate, and caregiver, parent. So think about it very simply, right? Like, what's your first gut instinct um, when you hear a baby cry? There's a part of you that's sort of called, right? Called, literally. You want to turn to the infant. You want to know what's wrong. Why do you want to know what's wrong? Well, because there's a kind of call of distress there. There's a need that's being expressed, and you spontaneously want to meet it. You spontaneously care about it. That's an attachment behavior, because what the ultimate outcome is going to be, all things considered, when you hear a baby cry, especially if it's yours, is you're going to get close to it. Proximity. What happens when you've got a toddler who's crawling around the house, and you look around because you've been kind of distracted, whether with paperwork or with something in the kitchen? You look around and you see that they're not there. You're going to call them by their name, right? Little little Jack or little Garri, where are you? And why are you doing that? To get them to get closer. Again, proximity is the predictable outcome of these sorts of attachment behaviors. And so the the one of Bowlby's students, his protege, Mary Ainsworth, she devised a paradigm for studying attachment behavior in human infants, and well, not quite infants, just like 1-year-olds and onwards, let's say. And this became a very important paradigm for measuring attachment. This is where the idea of attachment styles comes from, by the way, where you have, and let me run you through the actual study itself. You have like a 2-year-old, let's say, who is brought in with their mother into a completely new situation, right? A place they haven't been before. So it's a strange situation. It's new. It's unknown. It's unfamiliar. So they've got their mother, right? They're together with their mom. And then there's a strange situation, and there's like toys and all sorts of things there that they could potentially play with. First, they get there. When you observe their behavior, the infant is closely attached to mom, like hanging on and like looking around, looking and observing vigilantly, like what's going on, assessing the situation, getting familiar, right? Probing the nature of the situation through observation and attention. As this happens and familiarity grows, they become more comfortable to detach. So they go on the floor and start to move around a little bit, take baby steps, no pun intended there, picking up items and toys, and they start playing. So with increased familiarity, the proclivity to explore becomes more expressed. It finds greater expression. Then they ask a stranger, one of the investigators, right, to come in and sit on the seat that's right across from mom and kid. The moment the stranger comes, what you observe typically is the infants come back to mom, get close, and they sort of forget about everything else and are now looking only at the stranger. Again, something unfamiliar showed up, something unknown showed up, and the spontaneous response is fear and avoidance. You're trying to protect yourself. How are you protecting yourself? Through proximity with your caregiver. Okay, same arc of development then unfolds with respect to the stranger. Eventually, right, the kid realizes that this person is safe, and they actually start playing together a little bit. And here's the turning point, okay? The instructor had directed the caregiver, the mother, once the kid gets comfortable with the stranger, to actually get up without saying anything and leave. And in all cases, and they've studied this and replicated this paradigm and these outcomes like with very large samples. Though there are some cross-cultural questions that come up there, but we can sort of bracket those for now. What they observed is that in all cases, the moment mom leaves, it's like the baby had eyes at the back of its head, turns around, and starts crawling after mom and crying. But mom is instructed to leave. So she exits through the door and closes the door. And the kid is now weeping, terrified. It's all alone in a strange situation with a stranger. Okay, here is where the idea of attachment styles comes from. After some interval of time, probably a minute or two, mom is instructed to come back into the situation, into the room. And when she comes back, she goes back to the kid and tries to pick up the kid. And what they found is that there's 4, or let's say for now 3 relatively stable and consistent patterns of response to the return of the caregiver, the secure base, or what's supposed to be the secure base. In one category, infants, once the mom came back and held them, they were soothed and they stopped crying. And before you know it, they were able to continue playing and exploring again. This is the secure style of attachment. The idea is that even though you left and now you're back, I trust that you're here to stay and I'm okay and you're okay. There's nothing for me to worry about. So I can focus again on being in the world and exploring and making contact with the unknown. 2 more attachment styles, and then I'm going to pause so that we can discuss freely. The second category of infants. Mom comes back. The infant sees that mom is back and says, this isn't enough. And the kid starts to double down on crying. It's like, you're back, but how could you have left? I don't trust that you're going to stay, and I'm going to put extra energy and work into ensuring that you're here, because that's what crying does, because it's an attachment behavior, because its predictable outcome is, again, proximity. So I'm going to cry because that's my way of keeping you here. The final category is the second category, that's the anxious, preoccupied style. The final category is the avoidance style, or the avoidant dismissive. I think that's what it was called. I just call it avoidant because infant is crying when mom leaves. Kid is crying, mom leaves, comes back. Kid sees this and then gives mom the cold shoulder, is no longer crying, but refuses and rejects mom's attempts at being holding or hugging or being close, and pretends that mom isn't even there, and is even playing with the stranger now, more so the stranger instead of mom. And what they found here is that it's not that the child in this case is not feeling any distress, but all that distress is actually happening internally. It's just not finding expression. And so the basic position there is that I'm not okay, but I'm not going to show that I'm not okay. You're the problem. You put in all the work. I'm just going to pull away. So it's sort of like, I'm okay, you're not okay, but it's an insecure position as well. Because the relationship isn't trustworthy, again, from the eyes of the child. So the last category, very quickly, it's the disorganized category. It's essentially a combination of the first of insecure style of anxiety, I'm not okay, you're okay, I have to double down to ensure you stay, and the second category of insecure, which is that I'm okay, you're not okay. And what you see here is the child or the person oscillating in a kind of unpredictable way, disorganized way between these 2 insecure positions of I'm not okay and you're not okay.
The first thing that comes to mind to try and understand that and see if I get it is it's interesting that avoidance and fear and sadness when the mother leaves, like that's going to be an inevitable response, because to be able to play, again, as you say, it's like an evolutionary adaptation. Like you need that, you need some kind of attachment style. Like I guess the first thing to say, it's maybe an obvious point, is that you need a style, as you say, right? It's like we're gonna have to have something, right? And it's fascinating then how fundamental it is that. And I guess that's another question, and it will help understand it too, is how does it it starts at such a young age. It's something, again, we have to have some. We just come into the world. We're going to have a style, but how is it shaped? How are we just born with it? Are we born with a style? How does it come about? And we can go into how it affects us later in life. But I'm just first off, like, how does it come about for us as we're children?
A great question. Just as a sort of proviso that I'd like to add here is that, as I see it, and I think this is also sort of like stated in the literature, no one just has one attachment style. It's more like if you take a pie chart and divvy it up into different slices, it's like how much mental real estate does each of those styles as a probability, so to speak, take up in the context of your life. And so it's more a question of like, when does insecurity come to life in the context of your experience, and when does it not? So that's one thing to state. The second thing is that developmentally, there's both like child factors that are at play. It's usually temperamental differences. So like fussier kids, they tend to be more prone to developing insecure styles of attachment versus more calm or emotionally stable kids that don't cry as often, that also initiate contact, for example, by babbling, let's say, or the kids that know that they're cute, that experience.
Yeah.
And so it becomes like a playful, like, hey, pay attention to me, I'm talking, I'm doing things, they initiate contact. They're not just passive or sort of to themselves. So these are some of the factors from the infant side. From the parental side, again, I think it's consistency of when the parent is present to the child's calls of distress, which helps to build a sense of trust, a basic trust, that when I'm in need, the world will provide me with the resources. Or more than that, the world is the kind of place that can provide me with the resources to quell myself, my anxieties, and to soothe. So consistency is a big factor there. And also responsiveness. So if you cry needing something and you get no response, here's something that I would recommend anybody who's listening right now watches. Actually, it's on YouTube. Just search for the still face experiment. It's another paradigm, very famous, where child and mom are sort of playing. Child is babbling, mom is sort of mirroring, and mom is instructed to, at some point, cut all of her responses to make a still face. So first she was smiling, laughing, giggling, and then man, the child's response is so interesting because very quickly you see a certain arc unfold, which is the child notices immediately that the coupling, the close coupling is lost of the dyad. And the child tries to regain it by babbling some more, by doing those things that it knows normally elicit contact. When that fails, it starts to get uncomfortable. And that discomfort begins to manifest at a bodily level. It not only starts to scream, right, yell, cry, but also like its entire body loses organization. And this is really interesting to look at from an embodiment perspective, because when you're an adult and when you lose contact, when there's a rupture in a real and important relationship, you're probably not going to become disorganized externally at the level of the body because you're an adult, all things equal. But that's going to manifest itself internally as noise and anxiety and that knot, right, in the pit of your stomach, and the lack of focus, concentration, things like that. That's a version, a variation of the still face scenario unfolding in the context of your life. And how you respond to that is going to be prefigured, at least in part, by the kind of style that's going to be predominant, right? The attachment style that's going to be predominant in the situation. So if
Yeah.
you're anxious, preoccupied, you're going to double down. You're going to send that extra text every 5 minutes to make sure to see why the other person isn't responding. You're going to call. You're going to keep thinking about them nonstop. If you're avoidant, then you're just going to like silent treatment. If this is how it
Mm.
is, I'm just going to walk away. I don't need you. Why? That's a complete denial of the actual needs at play.
This might be a strange question, but can it can it be reasonable to think about attachment styles also as applying to like inanimate objects too?
What
Like,
are you thinking? I'm curious where your mind went there, actually.
no, well, today I was trying to like run some like regressions, just use some coding on this program called Starter, and I may or may not have been very annoyed at my code. You know, might have been some shouting at my code as well, which I'm not necessarily pleased to say. So it's just interesting that because you talk about the baby kind of responding to the mother of like suddenly I get no response from my my code, and it's not doing what I want it to do, and how do I respond? I'm not saying I respond to like that every time, but it's interesting because it just makes me think. I assume maybe it's not just to like people that you have this sort of
Hey,
style.
it's your great insight because and we're starting to take up the phenomenon of attachment and attachment formation and styles phenomenologically as variations of a type of experience that potentially goes beyond just the scope of interpersonal relationships. Like you could be attached to a place. What's your favorite restaurant? You could be attached to uh, an item. What's your favorite thing to play with in your downtime? You could be attached to certain memories. What do you tend to remember when you are feeling sad, for example, or when you're feeling hopeful? You could be attached to all sorts of different things. And the basic dynamic that's at play in all of these variations of this experience always involves some interplay between security and exploration. Security is brought on by familiarity, whether it's a familiar object. And by the way, that's what this comes in during like addictions and substance use disorders because knowing that it's something you shouldn't be doing, you still do it because maybe it's been
Yeah.
a familiar thing. It brings some sense of stability and constancy, consistency into your world, without which you wouldn't know what to do, where to go, who to be with, and what to say or think. So
Yeah.
it's the that you need familiarity in order to establish security, to encourage exploration and movement and contact with the world. But you also need uncertainty, the unknown, unfamiliarity, to elicit exploration from a secure base.
Mm.
So it's this opponent processing actually that shows up in the context of all these different types of experience as I see it. And so I try to pay attention to this dynamic as it finds life in the context of my work with patients, whether they're telling me about an experience that they recently had or how they've been starting to feel better and not knowing why, and just looking at these global trends as maybe mapping onto certain attachment dynamics that are at play. Because ultimately, what you want as you mature into adulthood is to internalize the sense of security that originally you can only attain externally through your caregiver. So that you could take your
Mm.
caregiver with you, right? Their spirit comes to inhabit your body and your embodiment in some sense, so that you can go out there and explore on your own if need be.
Interesting. Um, I think well, one thing I wanted to ask was last time we talked about the personality types and how it's not that extroversion or agreeableness is bad or good. There's this adaptiveness to different traits, right? And one's gonna be beneficial in different circumstances, right? So you can't say one's good or bad. I'm just wondering with attachment styles if there's something similar, like where different styles like adaptive, or is there some ways in which we can say like objectively there is like a bad and good attachment style? Just as a way to contextualize, like if we like start talking about how these problems can like afflict us as we're adults.
Yeah, great question. I'm not sure if so. Since the last time we spoke, I've actually been thinking about the kind of the risk of relativism that sort of comes about by looking at different traits as neither good nor bad, but only in relation to the kind of context the person is in. Partly because, like, the world, if we take it as a whole, whatever that is and whatever that would mean, but if we just assume it's one thing, the world as a whole, it tends to be good for most people, but not all people. So, like, if you're really at the margins of the personality trait sort of um, in terms of the different dimensions, if you're like at the 99th percentile on like all 5 traits,
Right.
it's going to be fewer contexts,
Okay.
all likelihood, where you'll be able to readily thrive. And so there's a sense in which it might be useful trying to stretch beyond your current self, not as a way of changing, but as a way of growing into the world based on what it's wanting of you in order to attain that fit. But the world now is acting as a kind of constraint as to what's relevant for you as a person, regardless of it, or maybe, regardless of your individual differences.
Okay, well that's a very helpful sort of contextualization. But also, I mean, partly when you talk there about, you could maybe say like one, you can't just say all personality traits are equally good, but also it makes you think that like having a distinction between personality and character can be helpful there, because maybe going into our personality traits, like for anyone, we can't say our personality traits are optimal, because given our environment, we're going to have to adapt as a person so that we can best fulfill our personality traits. And I wonder if something similar
Yeah,
occurs for like attachment styles. Okay.
yeah. For attachment styles, uh, um, I would say something very similar. Like the sort of humanist within me is like, don't pathologize unless you absolutely have to. And my initial sort of response to when somebody is in an insecure sort of state in the context of a relationship or whatever, it's not like, how do we change this? It's what's going on? Where else does this happen? What's your earliest memory of a similar feeling unfolding within you? How old were you? Was it like 3 years ago, or was it 30 years ago, or what? So first we start to parameterize through this kind of curious exploration uh, where this experience comes from, what it's like, what it means, and how it plays out in the context of the person's present life, and how it's maybe shaping the possibilities for the future for this person. Um, and then I again present it as a question of like, is this what you want? Why or why not? It's not uh, the outside in sort of like this is bad. I'm referring to scientific findings in psychology, et cetera, to tell you what you ought to be doing. It's more like, okay, with all that aside, how do you feel about knowing this about yourself? Where does that land? Where does knowing that land you? And if and only if they respond with, I don't know if I want this to continue. I
Mm.
think I want to change. I would rather it be different. Then I again don't give them an answer. Like, who am I to do that? I just get them to ask the questions that would make. Okay, so what do you think? Like, where are you at? What do you think is the next step? What's it feel like to you? Or, then we just begin playfully articulating the problem landscape that they're in. And so that the solutions that are generated are originating from their spirit, their consciousness. So that, because that's their birthright. Their suffering is their birthright. Addressing and remedying their suffering is their birthright. I see my task only as helping to facilitate that process of growth. Did
Do you
that
know?
did that answer the question of, yeah, like objectively, it's probably better to, like, look,
Mm,
if you experience a rupture in a relationship, you're going to be upset. The question though is how long should you be upset for, and what should be enough to quell you? And if you happen to be more on the insecure side, then you risk being upset for longer and much more than perhaps in some cases you should be. Because an insecure response, it places a burden and pressure on a relationship. And if the relationship doesn't have enough structural integrity to withstand and tolerate that kind of stress, then it might eventually collapse under that weight. And so security is like, let's be attuned to what's going on and not maybe presume the worst to begin with, and allow things to move forward so that a relationship can grow and become trustworthy and reliable and robust, etc., etc. So from an objective point of view, that's what my answer would be. But from the clinical treatment point of view, the approach would have, like, eliciting growth and movement into security would have to be, I think, done from the inside out in the way I was
I
saying.
see.
Uh-huh.
No, that helps answer it because in the complexity of our lives, like then only we can know if different styles are adaptive or not. And I guess one thing I wanted to pick on up on there is you talk about like you're actually in a relationship, right? And it's like say an insecure attachment style, is it actually doing bad or is it okay? And I'm just wondering, like, on attachment styles, but in general, if someone's coming to you in psychotherapy, like whether it's romantic relationships or friends or family members, what is their relation? If, I'm thinking about negotiation, how important is it to like talk to other people and think, how is my attachment style working in this relationship? How is my personality working in this relationship? Maybe this is like I don't know how to exactly phrase this, but I'm wondering if.
Do,
Go on.
do you think what you're sort of touching on could be understood as like how open someone feels with and around, like, family members or friends, in terms of, expressing your thoughts or opinions or feelings, like the openness to being
Mm.
your authentic self, let's say, for lack of a better word, versus the
Yeah, I would say yes, because in the sense that you're like trying to think about it, how you could improve with other people, right? And like it can be really difficult to say broach those situations, and that there's just the thing you said, like that would be an interesting area to explore, right? To what degree do you just want to go about trying to improve that like sort of comfortability with other people, and how important in general are the like relationship, the specific relationships people are already in with people, in like helping and also hindering, like growth.
So again, very great question, and also an intimidating question in the sense that there's so much complexity at play there, where uh, even the way the question is posed already brings with it assumptions that I might encourage you to bracket.
Okay.
The assumptions being, right, that I ought to get closer with the people that I have in mind that I'm feeling far away from. So I'm not saying that assumption should or shouldn't be there, but I would
Mm-hmm.
place it under question. Like, what's that about? What does that mean to you? Um, what's going on there? It might be different for different people, but that would be my first starting point. Um, let's say you like take it up within yourself and then think about it and sort of process it and come to the conclusion that, like, I do want more closeness in these relationships because, like, they matter to me a lot, and I feel like things could actually be better than they are right now, and why not? So what can I do about it? um, I would say, as with all complex problems, it always helps to be patient and to observe. you don't want to rush to solutions. So the first thing is, okay, if this is how it's been for a long time, then I shouldn't expect for it to change overnight or in a month or even in a year's time. So first, situate the problem in its proper temporal horizon. And this usually pertains to like family bonds and relationships because those are the oldest ones that we have. And what that takes is being able to like think about what it takes to see something as a long-term problem when you're actually experiencing a kind of sense of urgency to resolve it. And sometimes we have like I really need this and want this to change now because it's hurting in so many different ways. I'm imagining scenarios where uh, like a 17-year-old is applying for like university or college or whatever, and they don't really have the support of their parents, or they're about to make a decision and they feel like they won't get that support or understanding.
Mm.
Whatever that moment is, that's a rupture, it's not a one-time thing. It's more an instance of a broader theme or pattern. And what you're actually trying to intervene in is the broader theme that underlies it, of which that's a particular instance. So you might have to experience some losses here and there if what needs to be resolved is the pattern itself, which might take longer and require you to take more hits than you would like. In which case, there are supports that you should, actively seek out, like friends who do understand you, or if it's within reach, having a therapist, or anything that gives you energy and gets you in touch with the sense of vitality that you have, what makes you feel alive and in the world in some sense. The
Mm.
actual intervention itself, which I haven't gotten to, which I don't think I can get to actually, because it's probably one of those things of like, how do you treat depression or how do you treat, substance abuse or whatever? You got to know what it's about to begin with so that you can uh, tackle it at the level of the particulars. And this might be a bit of a cop-out answer, but like the last thing I might say, again, what I would start with is, are there ways in which the way you're showing up and being present in the context of the relationships that you want to remedy, are there ways in which that your manner of participation is actually complicit in enabling and perpetuating the very pattern itself? So,
Yeah, yeah, that's helpful. Um, but one thing you talked about how, say, addiction, or you have a certain problem, and like you want to treat addiction or depression, and you can only really solve it in the particulars. I'm wondering what you mean by that. And I can imagine someone like are there similarities? Like, are there things you can say about someone that comes in like with like an addiction or depression, or is it like, or is it really very unique to each individual?
I'd be lying if I opted for either of those answers at the exclusion of the other, actually. I think there's something going on that obviously unites and groups together all the particulars within the class that they sort of naturally belong to. Like all depressed individuals have something in common. We call it depression, and even if we don't know what it is exactly or how to understand it, it's something in common. So
Mm-hmm.
there's that categorization taking place there. But at the same time, um, knowing what applies at the level of the population of interest, um, I would just caution against the risk of using that information, whatever it is, as instruction from the outside in during treatment, because then it doesn't spontaneously arise from within the person, which is, I think, where most therapeutic change begins. So, with which category were you asking about? Was it depression or anxiety or what?
I was. I'm interested in both, but I picked up on the addiction. Saying you can only really talk about, say, one person.
Yeah, so I can tell you some general like features or qualities that people who fall under this category tend to have. Um, there is a certain, so my understanding is phenomenological, And there's, again, different schools, different traditions, different ways of conceptualizing this phenomenon. But I'll just tell you about how I tend to do it. So going back to the basics of attachment theory, how you've got the interplay between the known and the unknown of security and exploration happening. The reason why that interplay is fundamental is because that's how cognition actually complexifies and develops in the world. It's what we might call the hermeneutic circle, actually. I'm borrowing from the hermeneutic phenomenological tradition, but I'm using it in a slightly different sense, but just to make the citation. I have frames through which to understand the world. I come into the world and I see it through my frame of reference. And the problem is that the world is indefinitely complex. The amount of information available at any given moment is virtually infinite. And whatever frames I have for reducing that complexity are finite. They're finite in their utility. So sooner or later, my framing is going to have to break down. And how this happens within experience is anytime when I'm surprised or anytime that I'm anxious. Those are like the clearest instances of of a person's confrontation with the unknown. Surprise and anxiety, and then fear is sort of like it's a little derivative. What's more primary is anxiety. So what happens when you're confronted by the unknown and you're feeling surprised? Well, if you're attuned to the so one other thing, actually, there's two possible meanings that the unknown can have for people, and this applies across the board. The unknown is simultaneously where you need to go in order to get what you want, right? The unknown future is full of possibilities and opportunities. So there's a promise in pursuing the unknown. And it's the place where you could get hurt more than you can afford if you're careless. So the unknown is also full of threat. And at some point, we develop an innate kind of spontaneous fear response to strange situations and strange faces, which is why the infant in the strange situation scenario first starts off by clinging to the secure base from which to explore through observation. And as that exploration happens, familiarity grows, and if we represent the familiar as a kind of three-dimensional space, as a sphere, you can imagine that the sphere expands and expands. And so the world is expanding in some sense. And the unknown is shrinking in some sense. But it's irreducibly always there. The unknown is irreducibly always there. So what happens is, in addiction, interpretation, right, the hermeneutic circulation, it stops when the moment you confront the unknown and are anxious and afraid. The rest of it is sort of screened out. It's inaccessible. And all that's happening is you see something you're afraid of, you shy away, you pull away, you avoid, and that thing stays there. So the source of anxiety and fear, which is the uncertainty, it remains unresolved. And so anytime you turn and look and feel afraid, that's already being reinforced. So it's only going to perpetuate itself. And before you know it, that style of relating to uncertainty, to the unknown, which is to see the unknown as threatening, as something to be avoided, that begins to proliferate and infest the person's entire being. And before you know it, their world becomes organized around avoidance. And what helps them to avoid better than the intoxicated state of being drunk or being high? Anything that gives you a temporary fix. This is why a lot of people, including John Vervaeke, call these kinds of substances as existential junk foods, because they give you the semblance, the false impression that there's something meaningful and positive going on, that you're moving toward your goals, because it's only then that we experience positive emotion and a dopaminergic surge and activity, when in fact nothing like that is actually happening. And so you get severed from the world, while the world is continually shrinking. So that's how I would conceptualize addiction in a
Yeah.
broad sense, to the best of
It's
my
it's
abilities.
it's it's so intriguing you frame it like that though, that it's actually that addiction is about like a fear and unknown. And the reason in a way it's actually slightly, even though I agree, it's also a bit paradoxical for me. Let me know what you think of this, right? So like I talked to the cognitive scientist Mark Miller previously on my podcast. We talked about addiction as being kind of uh, in the predictive processing model of cognition, we try and reduce error, and we try and do things which sort of feed our predictions, and we kind of know what they are, and so addiction then is a bit about the known, because we go that if we keep going down areas that we know too well, down routes of reducing prediction error that are too well known, then we don't explore other areas.
Wow.
And so the one way I would think about addiction is then about sticking too much towards what we know, and at the expense of going towards other areas. But then I don't think that's contradictory to what you're saying at all, because it's kind of the flip side, right? Is that
Absolutely.
if we go down routes that we know too well, too often, then we, by necessity, you could say that we are afraid or we fear other areas. And so the flip side of not going down paths of uncertainty actually kind of is um, a something which pushes you back towards places you know that then do not actually again they kind of hijack your machinery, because yeah, they do reduce prediction error, and so they're cognitively makes sense in a way. It's not like your cognition, as Mark Miller so interestingly said, does not like your cognition is going wrong in that situation. It's actually doing everything correctly, which is what is so pernicious then about addiction, is that your cognition and your cognitive machinery is not necessarily going wrong, but
So that's so interesting. So yeah, for sure, I agree with all that. There's nothing contradictory per se, or that's what I was thinking until you said what you just said. I'd like to talk to Mark about this because um, if I'm taking that statement at face value, that technically there's nothing wrong with your cognition, with what it's doing in those moments, because all it's doing is what it's meant to do, which is to minimize error, prediction error. I would argue against that because that, to me at least, seems to buy into an account of cognition as like not in the world, not being about the world in some sense. Um, like it's not, because it's essentially a loophole. That's how I see it.
yeah,
It's a loophole. It sort of gets caught up in its own self. But the issue is that, like, it's driven by what I'll call the totalitarian impulse. And the totalitarian impulse is essentially that my frame or my frames of the world are the world itself. And everybody knows if they look deep inside for long enough that that's not actually true. Because again, uncertainty is irreducibly always there. And the true remedy that psychotherapeutic growth is sort of predicated on is the facilitation of a certain kind of relationship to uncertainty, to give it space and to be open to the unknown, to not just avoid it and shy away from it through anxiety and fear, which sometimes we ought to, but to salvage or secure the possibility that there might be something absolutely necessary to your being waiting for you out there where you haven't yet been. And maybe unless you do that, in some cases, you're going to pay a very heavy price.
that's really great, Gary. And you know, what me and Mark Miller were talking about was actually, he said it kind of in a tongue-in-cheek way that it's what your cognition is going right, because in a way, in a superficial way, it is. But the thing is that your cognition is not one layered; it's hierarchical. So if you reduce uncertainty in one level but ignore other areas, then in reality you're not doing any good. And the thing is that after we talked about addiction, we talked about sort of the antidote or the reverse of addiction, which we talked about would be play, right? And voluntarily sort of, you know, tackling more uncertainty, right? Which is just kind of what you're saying there, is that it's actually precisely going towards chaotic areas and it's and I don't know how this is going to relate to psychotherapy, but I do find I've been thinking about play a lot. I'm going to be talking also to Carl Friston on the free energy principle as well, which related to predictive processing, and it's fascinating because it's the one thing which seems so unpredictable to me about all life forms, because so many animals play, is that we would actively go and like almost test out the way we understand the world and test out our models and our fit of it. So rather than learning any one thing or trying to accomplish any one thing, we would actively go, hey, how does my cognition, how does the world work? And if I play with these things and I act, or I play with these toys as a kid, right? I'm actually going to be learning about how objects work, and that might help me in many different situations. And maybe there's something interesting to be said about this kind of attitude, and it's like helping us more generally. I don't know, but yeah.
Absolutely. I think you could probably like like the impulse to play is probably in everyone, but there's also probably I don't know the literature on this, so I'm like being careful with like what I say here, but there's probably individual differences in the factors that are predictive of like play proclivity in individuals. So I imagine that like people who are higher in trait openness are more likely to play with ideas or thoughts or aesthetic states and experiences, for example. I also imagine that people who are high in trait extroversion also share similar proclivities because both openness and extroversion, this draws on Colin DeYoung's work. There's a 2013 paper actually, which argues that the neural circuitry underlying both traits openness and extroversion is essentially the same. It's the dopaminergic circuits. And there's different subcategories of dopamine that are at play within both trait extroversion, um, which is about behavioral exploration. That's how Colin talks about it, and trait openness, which is about cognitive exploration. And I think that maybe like this also ties into no, this definitely ties into what we do in psychotherapy. We're really trying to promote exploration through play and curiosity, and we're trying to turn something that the unknown that has led people to turn away, run away, to avoid, we're trying to turn it into an inviting and welcoming unknown so that they can play instead.
Interesting.
Hmm.
Awesome. One thing that makes me want to ask about is
Sorry, Jack, but before
go
we
for
go
it.
on, I should get going in about 5 minutes. I just wanted to
Five
mention.
minutes.
Yeah, yeah, yeah.
Okay, okay.
Mhm.
Well, since we're wrapping up. A final thing I wanted to ask then is we've touched on many different areas. Um, what makes uh, client in psychotherapy or situation the most difficult to address? What are things which hamper it? Not necessarily in specific examples, but what makes something difficult?
Hey, I'm gonna touch on a question you posed, but that we never actually got a chance to pick up on,
Okay.
of transference.
Hmm.
Remember that question? Okay, there's so transference is the idea that it can be connected to attachment theory as well, but it comes from psychoanalysis, and it's the idea that because the client knows nothing about the therapist except for maybe a few small things, the therapist begins to act as a projective surface. So what that means is, as the client, I'm looking at you, the therapist, that I hardly know anything about, but I still got to make sense of you. How am I going to do that? Well, I'm going to have to rely on my prior frames. So how I've related to other people in the past, whether it's been my dad or mom or siblings or friends or teachers or whatever, that's going to come in and color and shape and prefigure the way I'm going to make sense of you, and therefore make sense of my role in relation to you. And so as the therapist, I try to listen to and try to notice when these kinds of transferential uh, uh, experiences are beginning to arise. And um, here's the flip side of it. There's this idea of countertransference that same goes the other way around. Like a lot of therapists, especially novice therapists, from my sense of it, they often find themselves in the position of sort of like my client is suffering and I don't know what to do, but I need to do something. It's
Mm.
like, where is that coming from? Not that you should or shouldn't do something to alleviate the suffering, but where is that coming from? Probably not from nowhere. And usually it harkens back to relationships that they've had, whether with family members or others, where they've adopted the role of a caregiver in some sense. And so, like, in that moment, you can turn to the therapist and say, do you want to be therapist as caregiver, or do you want to be therapist as explorer, or a therapist as friend, or a therapist as what? And why? Justify your rationale, because that's absolutely important. Because to justify it, you need to come back to the client therapy needs. What is the client needing in the moment? It might not be what you're spontaneously providing. And at the very least, you should be aware of what you're actually falling into and what's coming out of you, what's being naturally elicited by who the client is in relation to you. So my answer to the question of what makes what brings about difficulties and challenges in therapy is not actually transference on part of the patient, but more so counter transference on part of the therapist that the therapist remains blind to. Because you could begin to act out all sorts of things with respect to your patient that are counterproductive, counter therapeutic. And yeah, that's what I would say for now.
And try and maybe like force and try and again you can be too active because as you say you kind of need to let them do it yourself and have it be an exploration rather than be too much of a caregiver, right? Okay, well, do you have any last words or where can people find you? Thank you for this.
Hey, this has been great. I really enjoyed our conversation. I'll look forward for to a part three whenever it
Yeah.
happens. And yeah, I guess just as last time, you could put my academia profile there. Um, I'll be releasing a website in the near future, so I'll just let you know what it is
Okay.
when it's there.
Yeah, yeah, yeah.
And yeah, so I think that's good for now.
Awesome. Thank you. Awesome. Okay.